Alright, we're leaving off where the last video was. I'm about to start the IV. Perform hand hygiene. And I would go ahead and put a pad underneath the patient's arm, ask them to lower it below their heart level, and then put the tourniquet on. Alright, so I'm going to go ahead and put gloves on.
So that time, I'm going to remove it first and then do all. See how it says remove it twice? Yeah. Oh, remove gloves. Remove other. Yeah. Oh, okay. So remove gloves. Waiting for the policy.
So now I am going to palpate the area for a good vein. I found my vein. So now I'm going to clean it with the chlorhexidine. I'm going to go, well, I'm actually going to pop this. So I'm going to go back and forth. Cleaning it. Alright, now I'd let that dry for 30 seconds.
Is it gonna just start spraying? Okay. Until you put that.
So next, I'm gonna get my needle. I'll put bevel side up.
Really? Really?
I'm gonna let the patient know that I'm going to,
You gonna take a nap now?
Sorry. I'm gonna let the patient know that I'm about to stick him in the count of 3. But first, I'm going to place my non-dominant hand underneath to help stabilize the vein. So bevel side up. I am going to insert this at a 10 to 15 degree insertion level or degree. So 1, 2, 3. So now I'm looking for a flashback. Okay, I just got it. So once you get your flashback, you're gonna push it in just a little bit more. And then slowly insert the catheter. Sorry, I'm having trouble with the catheter.
18.
There we go.
17 for one video, and 18 to the rest is his diabetes.
So that is inserted. I'm gonna stabilize it and try to push down at the same time to help the bleeding. So I'm gonna pull it out and close the needle. I'll discard this and the sharps. So next, I'm going to take the cap off. There we go. Alright, so I'm going to insert this. Okay. Now that this is inserted again, I'm going to stabilize this. I'm going to go ahead and flush it. Sorry. Yeah. Do a drawback. So I'm going to unclamp it. Do a drawback and watch blood flow, which it did. So now I'm going to slowly push it through, and you want to make sure that it's not rising, because that could mean that you're not in the vein. The skin is rising, so that can mean that you're not in the vein. All right. So next I'm going to go ahead and put the clear sticker on. Again, holding down on this the whole time, stabilizing it. Oops. Well, I did this a little out of order, but gonna go ahead and clamp this, unhook this. Okay, I'm gonna go ahead and reapply this because I had covered it up. So I'm taking this off. Should continue to stabilize it. Okay. So again, going to apply the tape. Mess up the tape too. So I'm just putting that over. Normally I would wrap it around to make sure that it stabilizes more. From here, I'm going to make sure that there is no air in the tubes. So I'd unhook this, let it flow out. I'd done this on the previous video. Okay, so there's no air bubbles in there. And then I dropped my microbial thing, but I got it here. So I take the cap off and clean the end of these. So clean that with the antimicrobial, clean this, and then I would insert it. And then I would go ahead and date an initial, write the gauge size and the time and the IV site on the stabilizer, the clear stabilizer right here. And then I would unclamp this, verify that it is flowing. And then, you would go ahead and lower the bed, make sure the patient is, there we go. Lower the bed, make sure the patient is comfortable, and let them know that you're gonna check up on them in 30 seconds, and also remove this. Okay.